Hello, everyone. It's so nice to see you all for this Advocacy Academy session on how evidence opens doors. Today, we are collaborating for this advocacy session with Dexcom, with Dr. Annette Meller. We will have introductions later. Now we'll go through some housekeeping rules. Next slide, please. Yes, so this webinar will be recorded. The session, you will receive the whole recording if you cannot attend this session in its integrity. So don't worry. You can activate Zoom generated subtitles for the session by clicking on the closed caption button. So you will see it at the bottom of your screen on your Zoom window. Please note that those subtitles are not 100% accurate. The recording, the slides, and the feedback questionnaire will be sent to all registrants of today's session. And of course, if you attended 80% of the session, you will receive an attendance certificate. And please share with us, your thoughts about the session through a feedback questionnaire that you will receive after the session. And the certificate of attendance will be sent by you by the latest, the 14th of November. If you don't receive it, please share with us an email and we'll reply to you. So now up to Beatrice to present today's collaborator.
Yeah, indeed. Thanks, Daisy. And very good to see quite a few of you joining online. So you will see that today's session is a bit different than the ones that we normally organize, which are bigger webinars. Today we're here with Dr. Annette. She's going to be presenting some things that you're going to find very interesting. But yeah, before presenting Dr. Annette, I just wanted to brief you a bit on our collaboration with Dexcom. So Dexcom have been a sponsor and a collaborator of the IDF Global Advocacy Department for many years now. Yeah, we have been collaborating, I think, for 4 or 5 years. They support all of the work that we do with the young leaders in diabetes, with the Blue Circle Voices, everything that we do when it comes to the World Health Organization, global presence. So they are very important for the work that we are doing with all of our advocates. And this is a session that we have been thinking for a while. We actually wanted to have it in person in Bangkok when we had the IDF World Diabetes Congress earlier this year, but it was not possible. So we thought that it would be a very good opportunity to have it online, so actually more people who will watch it. I'm seeing that we have 14 people now live, aside of us 4 presenters today. So that's quite good. I think we can have an open discussion. You are going to be able actually to ask your questions in different moments throughout the presentations to Dr. Annette. So please drop your questions in the chat. And yeah, now up to Christina to present Dr. Annette.
Yeah, so hi everyone. Thank you for being here. So as you can see, the presentation today is about evidence and how research and evidence opens doors for advocacy. Dr. Annette here is Senior Market Access Manager. And in case anybody doesn't know what HEOR means, because I did have to Google it, it's on health and economics and outcomes research. So basically this presentation is all about data, about research and health data and how you can leverage that data for advocacy and hopefully your own advocacy objectives. So yeah, thank you very much, Annette, for being here today and for doing the presentation with us. This is quite an interactive presentation. We have quite a few moments where you can ask your questions directly, but also Dr. Annette has also prepared ways of digital interaction, so keep your phones ready for that. And yeah, I feel like we can go ahead. I'm gonna stop sharing and let your presentation and it starts.
So, hello everybody, and thank you so much, Daisy, Beatrice, and Christina for introducing me, and of course for inviting me to facilitating this session with you about how evidence opens doors and understanding access advocacy and health economics and outcomes research in diabetes care. So I will now start sharing my screen. Just a second. and go into the presenter mode. I hope it's working. I hope everybody can see the slides, and here you can see as well a QR code with my digital signature. So if you scan it, you have it directly in your phone. And if whenever there's a need to contact me at any time. So welcome again. This session is for all of you, for all the advocates, whether you're part of the Blue Circle Voices or the Young Leaders or any other advocacy group. This session is designed especially for you. And today, as I just said, we will explore how evidence, advocacy, and health economics outcomes research can help you open the doors for better diabetes care. Our goal is to give you practical tools and confidence to drive change in diabetes care in your country or community. So this is our today's journey. For the next 45 minutes, I've prepared a 5-point agenda with you. We are going through these 5 points, beginning with why your voice in diabetes access matters, and then setting the foundations. I need to change this. Okay. I will talk about access advocacy and health economics outcomes research, how they work together. We are going then to health economics outcomes research in action. What about value, costs, and real-world stories? And of course, point 4, your advocacy toolkit, how you can turn evidence into action. And we will wrap up with key takeaways and next steps. So whenever there's a question, please be free to drop them in the chat, and we are eager to answer them at certain points during the presentation. And of course, we will have an interactive session as well and a Q&A in the end. So I hope to hear from you, but let's start to get to know each other. Please raise your hand or, oh, what happened? Sorry. Sorry for that. I hope you can still see my screen. Here it is again. So yeah, I just wanted to minimize this one. Yeah. Okay, please raise your voice or use the chat. I would love to get to know you a little bit more and about your interests. Who would like to learn how to use evidence and your voice to improve access to diabetes technology and better diabetes care in your country? So please raise your hand, but I can't see you right now. But also please use the chat to do so. And I have prepared a little poll as well to get to know your experience with those topics and terms a little bit better. And I love you to attend in this service by answering the questions: are CGMs or diabetes technology in general available in your country? And you could now attend. Here's a QR code. Let's see. Yes, that's very good. It's available, and I'm very happy to hear that. Ah, okay. It's changing. Let's wait a little longer. Participants are still attending and giving their answers. So it's quite diverse. So in some parts of the countries of people who are attending, it's available and fully reimbursed. It's partially reimbursed, or it's not reimbursed. So we have here some diverse outcomes. So let's go to the next questions. Have you ever tried to facilitate access to diabetes technology in your country? Yes, successfully. Yes, but it was difficult. No, but I want to, or no. Okay, this looks awesome as well. We have some experienced audience here. I love to hear about your experiences, and of course, you're co-creating this session today here with me, and I love to hear what is your experience and how you can support each other in your advocacy by using health economics and outcomes research and, of course, access knowledge. Okay, the majority tried at least, but it was difficult. So I love to hear from you. And which of these terms are most familiar with you? Market access, advocacy, HEOR, or all of them? Advocacy, of course, since you're all advocates and very well trained by IDF and the academy and every session and campaign you're attending with. Okay. A minor part has some experiences or at least heard of those other terms. And this is why we're here, because I was asking myself, such an experienced group of people, what can I tell them? They have their stories, they have their experiences, but of course, there's still something I can educate and hopefully hand out some tools for you to even improve your access and your advocacy work in your country and community. Okay, why your voice matters in diabetes access. Of course, getting approval, reimbursement, and distribution so people can use the diabetes technology is complex. Even the best technology can't help people if it doesn't reach them, right? So if it's not available, it cannot help. And unfortunately, access is not equal everywhere. Us advocates, especially you, the Blue Circle Voices and young leaders, you play in a crucial role in this change that is going to happen in achieving market access. This requires a structured end-to-end approach, and of course, your voice is very necessary and crucial in this process, getting approvals, reimbursement, access. So really, the diabetes technology, whatever it is, it's a CGM or a pump, is available to the people who really need it. So are there any questions so far? Because we have now finished the first part, why your voice matters in diabetes care. Beatrice or Daisy?
So
Are
far,
there
no
questions?
questions on the chat.
Okay, perfect. So we are going ahead and to the second part of the presentation, setting the foundations. We are now building the blocks. What is access, advocacy, HEOR, so health economics outcomes research, and how they work together. Market access, on the one hand side, many of you have heard about this term already, means making sure the diabetes technology is approved, paid for, and available. Advocacy, since you're all experts in this field, is about raising your voice to influence decisions and support access. And health economics outcomes research, the acronym is HEOR, is about how or it shows if a technology is worth paying for. And all three of them work best together because it's a kind of circle process. The health economics and outcomes research data give the evidence that is used by market access, that is opening the doors, and advocacy, your voice, pushes it through. So they are working all three together in the best possible way. And of course, as you might experience it yourself, doing it all by yourself is very, very hard and very sometimes not so successful. So it always takes a team to win, right? And who really drives the change here in making this happen, giving access and reimbursement to diabetes technology by using health economics and outcomes research data? Of course, it's the advocates like you who raise their voice, making the change happen. It's the patients. Of course, here patients is the technical term. We are talking about people with diabetes who need access to care and technology. On the other hand side, there are the payers, the insurance companies, or the governments who decide what gets paid for, the providers, and of course, the regulators. And collaboration here is really the key and very essential for access and equity. So let's look and dive deep into the topic of health economics and outcomes research, made simple, proving value in diabetes care. It's about using data and to show the value of a technology. For example, CGMs cost more than finger pricks, of course, but they offer better quality of life and often reduce hospital costs and hospital visits. So health economics and outcomes data help answering the question, is the technology worth it? And often the answer is yes, because the data show the results. And it's used by governments, doctors, and insurers to make those smart decisions if a technology gets introduced into a market and who gets it reimbursed. Health economics and outcomes research guide decisions. It is used to build evidence packages for payers and regulators, supporting decisions on pricing, reimbursement, and access. It uses the tool's cost effectiveness. That means, is it a good value for money? We use here the terms of incremental cost effectiveness ratio, the ICER, which compares the cost of a new tech treatment to the health benefits it provides. And the lower the ICER, the better the value for money. The other tool that health economics and outcomes research is using, it's the budget impact. Here, the question is, can the system afford it? So it estimates the financial impact of adopting a technology across a population, and it considers the number of eligible people with diabetes, the cost per patient, and the time horizon. And of course, on the third tool, health economics and outcomes research is using, it's the quality of life. And here the question is, does it improve daily life? It's about the patient-reported outcomes that show how technology improves the lives of the people who use it. Your stories, by using the technology, they are real-world evidence, and that can be used to improve your advocacy and, of course, include it into the whole storytelling when it comes to talking to decision makers and payers. Okay, let's turn data into access, the HEOR pathway. It starts all by collecting the data on costs, outcomes, and quality of life. And then we turn this data into evidence, showing how the technology helps the people and saves money. The evidence is then used to influence the policy. The data gets to show and convince payers and policymakers to really introduce access and reimbursement. And of course, the access improvement, it's about helping more people getting the technology they need. And your voice is very crucial here. Your stories and the local data can help at every step in this process. But where do the data come from? Where does the evidence come from? You see here a pyramid showing several aspects of data and several sources of data, of course. It comes from real-world observational studies to clinical trials. But what I wanted to outline here, very crucial are real-world data and patient-reported outcomes. They are especially valuable since they reflect the actual patient experience and outcomes. That does not mean clinical trials are not important. They are really important when it comes to, for example, health technology assessments and the assessment of technology in order to make the decision if the technology gets access or people get access to the technology. So all those data within this pyramid, those sources are very crucial, but as well and especially important are real-world data and patient outcomes, since they are really representing and reflecting the actual patient experience and outcomes. And of course, using diverse data strengthens our case for access and impact in diabetes care. It's always good to have like a source of data available from several sources and several types to present to decision makers. But yeah, real world data and patient reported outcomes are very crucial. And of course, your story matters. Real world evidence and patient-related outcomes. Real-world evidence on the one hand side shows how a technology works in real life, not just in clinical trials, right? And on the other hand side, patient-reported outcomes are what patients say about how they feel and live with the technology. And you, Blue Circle Voices and young leaders are uniquely positioned to share these outcomes and stories. Right? Sharing them can be very powerful in advocacy. And in the end, why does health economics and outcomes research matter for people with diabetes? Health economics outcomes research ensures that healthcare decisions are evidence-based, cost-effective, and aligned with the needs of people with diabetes. It supports fair evidence-based decisions by payers. Of course, it helps patients to get access to the diabetes technology. It supports fair evidence-based access, decisions to payers and policymakers, and it ensures that healthcare money is spent where it helps the most, on what truly benefits people with diabetes. In short, health economics and outcomes research makes sure decisions are cost-effective and meet real patient needs. So it's pretty impactful and pretty important. And this is why health economics and outcomes data, so the data-driven approach for people with diabetes is very important. And how do we make the case? How do we influence payers and overcome barriers that you might have been experiencing during your advocacy work in your country and community? So to influence payers, it starts with strong clinical and economic evidence. Value-based pricing models means the price reflects the real-world benefits, like better glucose control or fewer hospitalizations. Offer risk-share agreements. That means agreements let payers and manufacturers share the financial risk. If the device doesn't deliver what it promises, the company may refund or adjust the price. And of course, engaging early with payers and stakeholders is very crucial and important. And of course, highlight patient-reported outcomes and real-world data. Your story matters. Overcome barriers by showing long-term cost savings by using the data that you gathered, proposing pilot programs to roll out in certain regions, for example, or align with health priorities of your national of your nation, so align with national health priorities, and use, of course, real-world data. Negotiating rebates or discounts, of course, this is also a fact that can help overcoming barriers here. So let's do a little quiz. What did you learn, and what do you feel is the correct answer to the question? What is the main purpose of health economics and outcomes research in healthcare decision making? Is it A, to promote new technologies? Is it B, to evaluate the cost and outcomes of healthcare interventions? Is it C, to replace clinical trials? Or is it D, to increase product sales? Are you still with me?
People are saying, Annette, that it
Yeah.
doesn't work. Some people are saying that they are not able to vote.
They're not able to vote. Okay. Maybe they can answer in the chat. I mean, I highlighted already the correct answer. So it's to evaluate the cost and outcomes of healthcare intervention. Sorry for that you are not able to vote. I was about to make sure this morning already that everything is working properly, but yeah, you never know. Sorry for that. I have 2 other quizzes. I hope that you can join them. So the next question would be, which of the following is not a source of health economics and outcomes research data? Is it A, clinical trials? Is it B, insurance claims? Is it C, social media posts? Or is it D, patient surveys? Okay. Okay. It's very diverse, but the correct answer, social media posts are not a source of health economics and outcomes research data, while clinical trials or insurance claims can be. Like real-world data, clinical trials are pretty important data and pretty important sources for health economics and outcomes research used in market access activities to talk to decision makers, building the story, building the claims, and of course, convincing them to really create access and reimbursement for certain and new technologies in a certain country or for a certain population. So here the correct answer, social media posts is not a source of health economics and outcomes research data, but clinical trials and insurance claims are, as well as patient surveys. Next one. Oh, congratulations, Ken, who did everything correct. Third question, which 2 types of health economics and outcomes research analysis help decision makers evaluate both the value and affordability of a new diabetes technology? Is it A, cost effectiveness analysis and budget impact model, B, patient satisfaction survey and clinical trial, C, advertising campaign and market share report, and D, social media analysis and patient review? And of course, 100% congratulations to everyone. This is the correct answer. Cost effectiveness analysis and budget impact model are the 2 types of health economics research analysis to help decision makers evaluate both the value and affordability of a new diabetes technology. So again, congratulations to all who participated. Okay, we are finishing the second part of the presentation, setting the foundations. And are there any questions? I will pause here to make sure that your questions can be addressed. Or comments. I feel that there are no questions. Is that correct?
Annette, we marked that Subia asked a question during the presentation, so I'll just read it from the chat. How can local advocates like us contribute more effectively to the market access process when policy and reimbursement systems are weak or underdeveloped?
This is a really good question. Thank you for that. Of course, we are all facing some hurdles, some conflicts, or some challenging environments. What I can tell you at this point to support market access and reimbursement decisions, even though the environment is not ready, you feel, or you might feel that the environment is not ready, using data, collaborating with experts, raising your voice, and of course, collaborate with everyone who you feel that could be of influence and also could be a decision maker is really important. And of course, keep on going. If the first time is not working, go the other time as well. Work on your story, work on the data you're presenting. Really try to present the value of the new technology, even though the environment might not be very accessible or very open for the new technology, but keep on going. Each try is worth it. And yes, of course, also we as a company, we need collaborators. We need to know who are the stakeholders, who could be the influencers, and who are the decision makers, and what could be the strategy for us as a company in collaboration with you, young leaders and Blue Circle Voices, and of course others. How can we make the case and really prove the importance of a new technology, and that it's important to gain access for people with diabetes to the certain technology. So it's about having a plan, making the strategy, using data, creating the story. But all of this is addressed as well when we go further into our presentation today. So this is a just quick outview. And yeah, we will come to the points, and I will hand you out a kind of checklist as well, what you can do. And of course, reaching out to experts, this is always a good thing. I hope this answers the question.
We have a couple of more questions. Some from Derek. We need to update whole old mental health statute laws. Agreed.
Was it a comment or a question?
It was more of a comment. And then we have Ridi as well for an advocacy presentation to be made to the government and associated stakeholders. How do we build a data toolkit?
Yeah, so for you to know, you don't need to be an expert on health economics and outcomes research, and you don't need to do it all by yourself. I will show you some tools and ways how you can access health economics and outcomes research data that are already available. Companies like Dexcom and others, we have tons of evidence. We are having clinical trials data. We have real-world evidence data. We have also patient-reported outcomes data. And there are so many scientists out there, and they are publishing papers that you can use as a source of valuable data for your story to build. And you see there are cost effectiveness data available out there, real world evidence data, all kind of data that are necessary for you building the story and talking to your relevant stakeholders and decision makers. And of course, it's necessary for you to know who are your stakeholders and the decision makers, and what kind of interest do they have? What's the unmet need of the person? Really study the people who you are talking to, and you will know how to build your story to really address their needs. I hope this is answering.
Yes, this is the end of the question. So yes.
Okay, then.
We
yeah.
just received another one. Yeah, it's more of a comment. So yeah, we can proceed with the presentation. Thank you.
Okay, so I hope by continuing this presentation, it gets clearer for you what kind of tools you can use, and of course that you don't need to be the expert in health economics and outcomes research. There are experts out there. They do every day health economics and outcomes research. They do nothing else. So they are really the experts, and they can help you providing the data. So, and let's keep on moving, and I hope it gets clearer as we go. So part 3, health economics and outcomes research in action, value costs and real world studies. So let's really look at the real world examples of how market access, health economics and outcomes research and advocacy work together. These stories show how theory becomes practice. We learn from the successes, and of course, we learn also from the failures. And then we understand how access, value, and outcomes really connect, and like how you as advocates really can drive change. So you might be aware of some success stories. I brought you here 3 of the of the key success stories that I have in mind when it comes to CGM technology or pump therapy. And of course, there are many others out there, but this is just as an example. And of course, I'm from Abbott. I'm from Dexcom, but still Abbott and Medtronic, they are pretty well-known companies, and they provide also very good products. And of course, they have success stories to tell. And let's look at Dexcom, for example, the Dexcom G6. This is a real-time glucose monitor. You might be aware of it. The success story goes like this. There was early FDA approval. The company had strong health economics and outcomes research data to provide when it comes to clinical effectiveness, cost effectiveness, and real-world impact in both therapy fields, type 1 diabetes, and of course also in the type 2 diabetes population. Dexcom partners with advocacy groups like IDF, as Beatrice just mentioned in the beginning. And as a result, the company gained broad coverage and high adoption. And this also applies to Abbott and Medtronic. They have great products on the one hand side, but they have a great strategy and great data to provide the case that the technology is worth it to pay for, and that patient really, or people with diabetes really benefit by using the technology, and that the system at the end also saves budget. It saves hospitalization, and this is what payers and decision makers wanna see. So this kind of impact you can have as advocates, working together with advocacy groups and partnerships, working together with the companies. This is very effective. Having a great product, having early approvals from the regulation side, providing strong data on cost effectiveness and real world impact, partner with advocacy groups, and of course, the result will be broad coverage and high adoption. So what is it that a strategy makes successful? And of course, it requires early engagement with payers, decision makers, governments, whoever is the decision maker in your country or community. Engage early with the stakeholder. Provide strong data. I told you that the data is out there. You don't need to reinvent the wheel and make your own health economics and outcomes research, but there's data out there that you can use with the help of the experts that provide the data. Of course, it is a need of education on both ends. People with diabetes and provider education is very necessary. Advocacy partnerships are a key for success, as I already mentioned. And of course, you might have, or you need to have a regulatory approval for the technology to entering the market. And advocacy is very essential at every step in these success strategies. But what happens when strategy fails? Okay. When strategy fails due to weak health economics and outcomes research data, no payer engagement, poor user experience, maybe there are some regulatory or safety issues as well, this will result in low access and low adoption. And of course, advocacy can prevent these failures, but it is very, very hard. And I have brought here some examples of failure. Sometimes the technology even doesn't exist any longer on the markets. And I will just mention those. It's, for example, the Pelican Sun GlucoWatch Biographer or the Asante Snap insulin pump. All of them, they closed or discontinued the product and the market access for the product because of lack of either regulatory circumstances, no data presented that really prove the case that is a cost effective and a really is beneficial for people with diabetes. So you see here that these cases show that a comprehensive strategy is very essential, providing the data, talking to the stakeholders, including education for both people with diabetes and healthcare professionals, and of course, collaboration and advocating is the key for success. Collaboration works. I already told you. All of these companies that are successful in the market and with market access and reimbursement for diabetes technology for people with diabetes, they are all collaborating, for example, with IDF or with other nonprofit organizations to really show that the CGM or the pump or whatever technology is at a decision that really shows that it's beneficial, and that really advocacy change the policy, and working together closely in campaigns and partnerships on national and EU level, it helps expanding the access and really expanding the reimbursement for people with diabetes. And also it supports during health technology assessment submissions, and yeah, everywhere you can think of, collaboration works. And the Blue Circle voices and the young leaders are vital partners in these efforts, of course. Your voice counts. So what are the key takeaways for this part of the presentation? Health economics and outcomes research combines value, outcomes, and access by using data, education, and advocacy. Collaboration is very powerful, and of course, the goal is to improve equity and make an impact for all, and really creating access and reimbursement for people with diabetes to the technology that is very beneficial for them. Okay, I will pause here again to give room for questions, comments.
We haven't received any question in the last part, I think. No.
Okay, I think we are quite into the time. It's 2:15. I have some slides here still at hand, but let's keep going, and yeah, we will come to the reflection exercise as well. So point 4, your advocacy toolkit, turning evidence into action. Advocacy starts with your story. Personal experiences make the case for change. Use data and surveys to show impact and support your message. Take action. Write to policymakers. Join advocacy groups, as you already did, and use social media to amplify your voice. Every step helps building momentum for better access and diabetes technology, of course. So tell your story, join a group, use social media, write to policymakers, and of course, use data to support your story and show the impact. Now we come to the interactive reflection. Let's take a few minutes to reflect on how this could work in your country. Pick one of the diabetes technology like CGM or insulin pump or any other, and think about 3 things. What's the biggest access barrier in your country or community? Who could help with advocacy? And what kind of health economics and outcomes research data could convince payers and policymakers? Write down your thoughts, and if you are comfortable, share in the chat or also raise your voice maybe during the Q&A session in the end of this session. So take a moment and really think about these questions and how you could take action as well. So the first ideas are most often the best ones. Don't overthink, just write down what you feel, what's in your gut, what did you just learn? What's the biggest barrier in your country and how can you overcome overcome the barrier by getting the help and using your voice, raising awareness or influence policy? And what kind of data could convince payers and policymakers? I will give you some more time and then move forward.
So some people are writing in the chat, Annette. I'm not sure if you have, I'm not sure if you see the chat since you are
No, I
sharing
don't see.
slides. Okay. Okay, let's give people a bit more time then, and otherwise we will read the comments to you. Otherwise, remember you can raise your hand and we will unmute you. Up to you.
Also, if you're not comfortable sharing your thoughts now, you can share it maybe later with your peers in the WhatsApp group you have, or also in the Q&A session we will have in a bit. So yeah. But the most important thing that you should have learned, collaboration is the key. Sharing your voice, sharing your thoughts. There are so many experienced people here on this call that have already tried to create access, and you're all doing your advocacy and you are all experienced. If you share what you experience and what are your thoughts, you are learning together and of course can create very, very good things in terms of advocacy for access and reimbursement for diabetes technology. So build the ideas together. You don't have to do it by yourself. Benchmarking ideas are always good. Blueprints. Whoever was successful might be willing to share what he did or she did to be successful, what worked. Okay, Beatrice, what's the status?
Yeah, let me check. So I'm seeing here really mentioning CGM and its use benefits could greatly help to influence policy. What else? If we show politicians, policymakers the results and the benefits of improved health outcomes, of course, that's what data is for, and that's the power. Derek is mentioning that, in general, policymakers, he's mentioning England in particular, ignore hypoglycemia and the effects on health. Ken Tate is mentioning having type 2 diabetes is a barrier even with evidence. That's another problematic. Sobia is writing quite a lot actually. So the biggest barrier in her country, which is Pakistan, to CGM and insulin pump is the high cost, the lack of insurance coverage along with the limited awareness and availability among both people living with diabetes and healthcare professionals. So yeah, a bit what we have been discussing. There is not enough education on the benefits, on the actual future savings for the healthcare system. So that's something that we need to advocate. Heather Koga from Zimbabwe. Some of the biggest barriers in a low resource settings include limited financial resources to access these new technologies, limited access to healthcare infrastructure, lack of awareness and education, regulatory and policy barriers, and a lot of bureaucracy, limited knowledge and training of healthcare professionals as well. And Pedro Alderjani from Lebanon is mentioning pricing and the healthcare system in his country. So that's a bit what people have been mentioning. Kasif Ali just wrote, CGM is not widely available in my country due to the high cost. Advocacy can improve the use, but for showing the data to the policymakers, we have to make high numbers of camps or trials to patients to get reliable data.
Yeah, sometimes it's that payers or decision makers are not accepting data coming from abroad or from other countries. They say, okay, it's not reflecting our community here, but whatever barrier there is out there, keep on going, keep on trying. Whenever there's a hindrance or a barrier, try to overcome it by really telling your story, using the data. Try to find the right stakeholders, try to influencers. If this is not the right decision maker or the right person to talk to, please find another one. Advocate, collaborate. Try blueprints that have been working in other parts of the community in another country maybe as well. So keep on going. Don't let those barriers bring you down. Your voice is very important, and your activity, your advocacy, everything that you are doing, I will encourage you keep on going. It's very important, and you can make the change, even though the barriers might be so much and so huge, and not be able to overcome. But one day you will be successful by really using also the tools and takeaways that I am mentioning here, and also please use other sources. It's not that I have everything here written in stone, but please do your research, make your contacts, and use whatever tool and source you can use that makes a difference for your case and your story, to support really the story, to meet the unmet needs also of the stakeholders. Really know your stakeholders, their unmet needs, and how you can address it with your story, with the data you have, and just keep on going. Tools and takeaways using health economics and outcomes research in your advocacy. Cost effectiveness analysis, of course, show value for money. Budget impact model, show affordability. Quality of life data, show patient benefit. Real world evidence, show real life effect and impact. Patient reported outcomes, show what matters to people, and really create your value proposition. Communicate clearly. For example, this tech reduces hospital visits and improves safety. This is something that policymakers and decision makers want to hear, right? Where can they save on the one hand side when they have limited budget, and they need to decide, okay, where do I spend the budget on? But okay, this costs so much. Is it really worth it? Yes, it is. But now I have not so much budget left for other healthcare circumstances. So you can prove that, okay, this technology on the one hand side is an investment, but it saves on the other hand side as well. It saves you hospital visits. So you can really start saving at this point in healthcare system, and really shift the budget around, right? So really tell the story using the tools. And of course, I said it already several times, partner for impact. You don't need to do it all by yourself. There are experts out there. Many cost effectiveness analysis and budget impact models are already published. There is no need to start from scratch, really. Look at the internet, try to find out cost effectiveness analysis for CGM, for example, and you get results. And then do some research, read through the published papers, look who is the author, contact the author, ask your questions, try to convince them for collaboration, or at least providing some more information and data. Advocate should connect with health economics and outcomes research professionals in industry or academia. Collaboration is expected. Independent modeling not. You don't need to model yourself. There are really experts out there, and you can really connect with them via LinkedIn, via other social media sources, via the companies. You figure out how to contact them. Search PubMed, Google Scholar, ISPOR, or HTA websites about the keywords of CGM cost effectiveness, or diabetes budget impact models, or pump therapy, whatever is the case that you are interested in. Use those tools and really do your research. Contact the corresponding authors or connect via LinkedIn. I already mentioned it. Look at the papers that are out there that are published. Look who has been written and has been involved in the research and in the modeling and of course in the publication. Try to connect and contact the authors. Ask for insights, data, or collaboration. And of course, there are other institutions you can reach out to. Universities, get research support, student projects, industry, shared goals, HEOR expertise. You can really contact me at any time. If I'm not able to answer your question, or if I'm not the person who's the right contact, I will try my best to connect you with the right person in our company, that you get the information that are necessary for your case and your story and your advocacy work. Join advocacy groups as you did already. Amplify your voice. HTA buddies understand evidence needs. Researchers are often open to build to dialogue. So please contact them. Start a conversation, and of course you will be amazed how collaborative everybody is. Here's another checklist for you. Steps to effective advocacy with health economics and outcomes research. Again, define the access problem. Really write down what is the problem. Gather the right health economics and outcomes research and real-world data. Build a compelling value story. If you know your stakeholder and their unmet needs, you know how to build the story. It is another story when you talk to people with diabetes than to policymakers or to payers. So you need to adapt the story a little bit, but the message should be clear. Identify and engage with the key stakeholders. Tailor your message to the decision makers, and of course, monitor outcomes and adapt the strategy if you feel the barrier you cannot overcome. Takeaways and simple steps. Use simple data to tell a powerful story. Partner with doctors, people with diabetes to collect evidence. Share real-life examples with policymakers. Combine health economics and outcomes research with advocacy and access strategies, and adapt the tools to your country's health system. So I just have 2 more slides to go, and then we can open for Q&A if there still is time. Take-home message. Health economics and outcomes research really is the data and the story building. It helps to show why diabetes technology matters. You can advocate. Use your voice, and your experiences are so powerful. Together, you're stronger. When health economics and outcomes research, market access, and advocacy work together, change will happen. So what's one thing you'll do after today's session? Let us know. What is the one thing you'll do? And you don't need to be an expert to make a difference. Use your voice, your story, your data. Start small. One conversation, one action, one step at a time. Together we can make a difference, and we make diabetes technology accessible for everyone who needs it. If you need support, I already said you can contact me at any time. I will make sure you get the information you need in order to do your optimal advocacy. At other companies, search in LinkedIn, search for titles like EMEA Access, Advocacy, or Policy, and you will find the experts you can contact and ask for help for your advocacy work. And this was my closing. And I wish you all the best. I hope I could give you some tools and some knowledge and some education for your advocacy work. And yeah, I'm open for questions if there's still time. And really, if you're willing to share any of your experiences on the reflection and what's the next step you will take, please, Beatrice, if there's time, I will stop sharing it now.
Hi, Annette. Thanks a lot for the presentation. I think it was a very interesting session and something different from what we have done so far. So we will be asking everyone to share your feedback. And if you enjoyed this session, we will try to do something similar in the future again. Some people are asking if they're going to get the slides. Yes, we're going to be circulating that together with the link to the recording. Ridi, for example, has shared her next step, which is going to be to look up at more data to build a compelling story. So that's a bit the point of this whole conversation, how to use data. So that's definitely a great step. Some people say they really enjoy the session, but yeah, so far not more questions for you, Annette. We will make sure to share via email if we receive any more questions, and of course you share your email address, so yeah, people can reach out directly to you.
That was what I wanted to say. If there are any questions afterwards, I mean, of course, you have your community and you are experts yourself. You can help each other out in your WhatsApp group. But if there's anything you want to know, reach out to Beatrice, to Christina, to Daisy. They can collect those questions, send it to me, and I will make sure to answer all your questions and send it back. Or, of course, if you're not willing to share it in the group, you can also contact me individual. Here are my contact dates, and yeah, thank you so much. I enjoyed it as well.
Great, absolutely, and of course, this is one of the key things we do at IDF. We really try to embed data and epidemiology in everything that we do, especially in advocacy. So this is definitely a topic that we like coming back from time to time. So in 2026, we will have opportunities to have additional sessions on this topic. So yeah, before we move to the final slide and yeah, a reminder of our next event, just from our side, from IDF, maybe highlight something very important that Annette has said. There is no need to duplicate work. There is already a lot of data out there, and we should be working with each other. There is no need to start reinventing the wheel and doing again something that someone else has done. Really, the key here is to collaborate together from civil society, from diabetes organizations, IDF globally, but also your national diabetes associations. You as advocates, try to speak with academia, with researchers from your country, and also take a look at what is happening in other countries. So that's very important to see how policy is evolving in similar countries, such as yours, and speak with each other. You have an IDF LinkedIn group for advocates in which you can actually exchange ideas and experience on what have you been doing in your country in this area. So we recommend you to do that. And now, yeah, I give the floor to Christina to go through the last slide.
There you go. Well, of course, I also wanted to thank Annette for the presentation. It was super interesting. And yeah, as Bea said, yeah, it's just the importance of data and of collaborating with different organizations that work on the same thing is very important. And I feel like it's kind of what we did here today as well. So yeah, just thank you very much. And yeah, just a few closing remarks, because I also saw in the chat a couple of questions about the slides and everything. As always, recording, slides, and the feedback questionnaire will be sent to all registrants. So if you want to revise this session, if you have yeah, a question you want to revisit, look at it more deeply, you can do so. And yeah, if you answer the feedback question, it would be great for us, because then we will have a bit more information of how to make sessions a bit better for you guys as well. But yeah, you will also receive a certificate, which is nice to have. And yeah, as always, if you have any questions about the session, about the technicalities, you can always send us an email and we'll get back to you as soon as we can. And yeah, just to close off, we have another session. Daisy will speak a bit more about it.
Yes, so be ready for other webinar, which will be an informational webinar, but very important for you as advocates of our networks. So it's about the World Diabetes Day. We all wait for it. It's a huge event for our communities and how to get involved with WDD this year. So the event will take place on the 16th of October. So very, very soon at 2 Central European summertime. So you have to check to convert this time to your local time zone. And you have, of course, a QR code to see all the info about it and register to the webinar. We are hoping to see you all there. And now I think we are done with the presentation.
Yeah,
So
some people are asking about screenshots, so maybe actually we can stop sharing screen, and if everyone wants to open their webcams, if they feel comfortable, we can take a group screenshot.
yeah, don't be shy, join us so we can have a nice
So beautiful faces.
Do we have more people for the last screenshot? We have more people. Nice.
Yeah, some people are still opening their webcams. Okay, nice. Great to see so many familiar faces.
All right, so I will take a first screenshot. So please show us your best smile. Good. Maybe another one just to be extra sure that we have everyone. Nice. Thank you so much.
Thanks, everyone. We will be in touch soon with all of the materials we mentioned. Thanks again, Dr. Annette. It was really, really an insightful session. Please respond to the feedback questionnaire. We always repeat it, but it's very important that we get your feedback.
Thank you.
Thank you, everyone.
Bye, everyone, and
Bye. Take
good
care.
luck. Ciao.